I'm writing a book that is called Healthcare Must Change, but Don't Change Me. And you can make that me be us as individuals, because I think Senator Aguilar pointed on it. The best controller of cost is us. I haven't worked out in 3 weeks. That's not good, right? Pharmaceutical companies don't want to change. Hospitals don't want to change. The healthcare insurance industry doesn't want to change. They all think it needs to change, but they don't want to change me. I think that is part of the heart we've got to get to. If we can all embrace at whatever level, we have to be part of the change to make this right. We will get further ahead. And that includes community health centers. Now, I am not a popular voice amongst my brethren because I often say that and they're like, oh yeah, but we do it right. Yeah, but we have to change as well. So I just offer a echoing comment.
Those who are in the middle of the healthcare system today, yeah, it's going to be disruptive. It was true through civil rights, and it's through the change of women's equal rights. And we're better off because of all that disruption.
All right, thank you, Deb. Bring us home. Thank you very much.
Well, good morning, everybody, and thank you so much for being here, and thank you to our wonderful speakers. Again, I think a great event. Hopefully you're going to leave feeling a little bit clearer about what it is we're talking about, what some of our options are. Ruth asked me to just make a couple of closing comments, and some of them are a little bit down, but for the most part, this encourages me. The people that are here, we're at a crisis point. The healthcare system's about to collapse, and I'm cheerful about that. For exactly the reason that Mitzi just said, is that we're not gonna change until we have to. People don't change unless they have to. Why do it? I'm perfectly happy the way I am, and I don't know how I could be any happier until I get happier. So it's not a bad thing, I think, that the healthcare system's about to collapse. What is a bad thing is how extraordinarily damaging it's going to be to the people that are really caught in the collapse. And that's why we have to make sure that it collapses as gently as possible and that it's rebuilt as quickly as possible. But that's not going to be easy. Healthcare is almost 20% of our economy. All the other countries in the world that have figured this out a little better than us didn't have anything near the complexity or the scope that we have to unwind to make this change. And yes, it's going to be incredibly disruptive. And we're going to have to do it our way for all the ideological reasons that are out there. We have to agree on something, and we have to just move away from just disagreeing to finding a few things to disagree on. And I think the values issue is where we need to go. We believe in market justice. We also believe in social justice. There's no reason that a system can't honor both of those. Competition's not a bad thing. We just don't want our providers competing on the basis of price. We want them competing on the basis of access and quality. We want to choose our providers not because it's the cheapest person out there to go see, but because it's the person that's going to see us when we need it and is going to give us the highest quality care, because in the long run, that is what costs less. So what do we do about this? Well, first of all, as a citizen, we just need to outpressure those special interests we talked about. And that means you need to keep calling, and you need to keep calling them out on their hypocrisy. When our local representatives, our state representatives, wax philosophic about competition and free markets, and then turn around and refuse to let Medicare negotiate drug prices like you would in a free market, you need to call them on that. You could see it foul. You just contradicted yourself, and I'm just simply not going to accept that as your constituent. As a patient, we also need to do those same. We need to defend ourselves. Healthcare is not our friend right now, no matter how many good, well-intended, competent people there are in it. The system is against us. So you need to demand transparency. I don't know if any of you saw the Channel 9 series, Send Us Your Bills. Go watch those segments. They collected bills. There's another segment out there called Buyer Beware, Surprise Medical Bills. Go Google that. Watch it. You have rights. And the healthcare system is sucking the life out of you in ways that it really doesn't have a right to do. And you can defend yourself. Stop talking about insurance. It's a red herring. I teach ethics. I teach students about logical fallacies. Insurance is a red herring. That means they're talking about something that's not really the problem. And it really isn't the problem. The problem is access, the problem is cost, and the problem is quality. And so when you talk to your insurers, talk about access to services, cost of services, quality of services. Stop talking about insurance. Insurance is not the problem. And while we're talking about logical fallacies, call them on the rest of the stuff. Socialized medicine. This is socialism. That's called slippery slope argument. Yeah, if we do this, then the next thing you know, we're not going to be any better than Russia. We're going to be a bunch of socialists. That's stupid. Don't fall for it. Don't put up with that. Either or reasoning. Either it has to be a free market or it has to be socialism. I mean, that kind of thinking is not going to get this fixed. It's too complex for that. There isn't a single answer. There's a combination of answer. That if we just get insurance right, if we just let competition work, that's magical thinking, okay? Call them on it. Make them squirm. Don't let them... They're not going to win you over on sound bites, but they have a tendency to silence you on sound bites, and don't let them do that. Make them go past the sound bite and actually justify their positions, because when it comes right down to it, most of the positions that are against some form of universal access to health care can't explain it. They can't defend it. There is no justification. So go out there, fight the good fight as a citizen, but fight the good fight as a patient too. Go out there and stand up to your providers, stand up to your insurance companies, and put the pressure on them as well as your legislators. Congress is not going to fix this. I know we all would like to think that. They're not. They have no will, and they don't even seem to understand it well enough. But we can fix it. We can fix it. Consumers can fix it if they simply educate themselves and then go out and defend themselves in the face of those special interests. Thank you for being here, and I'm going to turn it back over to Ruth.
I think the answer to can you do this incrementally over time is a resounding maybe. But be careful, that's a very slippery slope, that the more you try to do a piece at a time without really getting at the cost drivers, like the excess administrative costs, that's huge. All the things that were mentioned about what a true single-payer system can do. When you don't get at that quickly, you allow the opposition to say, see, it didn't work, and we should stop this now. So maybe the political reality is you have to phase it in over a few years, but just be careful about that. If I can add one other phrase, I've been using the phrase improve Medicare for all. The improved is a key point there. For those of us age 65 and older, we love Medicare. For it to work for everyone else and to work better for us age 65 and older, there are some changes that are needed, and that's why we use the phrase improved. And that's the discussion we should be having, how to improve Medicare so it works for everyone, not, as was mentioned, waving our hands over here about how many people are insured when insurance doesn't mean squat if you've got a $5,000 deductible. The question was, what would you improve in Medicare? There are 4 or 5 really good questions that should be debated right now. The Medicare model says Medicare sets the price, then agrees to pay 80%, and the patient pays 20%. Why do we want to keep the insurance industry around for that 20%? How is that helping anything? We're still forcing that unnecessary administrative overhead for the doctors to have to bill and rebill for that 20%. I then, as a senior, buy another insurance policy to cover that 20%. I'd much rather put that same money I'm putting into the Medicare for all and know everything's covered. Secondarily, basic levels of vision, hearing, and dental. Why should those not be viewed as basic health care? Everyone bumps into these at some point in time, and they're all now add-ons. Why shouldn't we be rolling that in? And another equally important one is fairness to the doctors and even the hospitals to some extent, but clearly fairness to the doctors. Make sure they're paid properly. Right now, primary care physicians aren't. So we need to rethink how we're paying the doctors, get rid of the $20,000, $30,000 variation on how payments are made. The other thing about being fair to the doctors is you've got to push the reset button for them. They've got an enormous amount of administrative minutia they have to put up with trying to deal with this unnecessarily complicated system, and it's burning them out. Push the reset button, trust them to work with you to do the right thing, and then deal with the outliers that aren't, and get rid of some of that administrative headache for them.
The United States spends so much more on healthcare than any other developed country in the world, and yet is the only country that does not guarantee access to basic healthcare to all of its residents.
It's not a bad thing, I think, that the healthcare system's about to collapse. What is a bad thing is how extraordinarily damaging it's going to be to the people that are really caught in the collapse.